All right. Hey, everyone. This is Dan Toner. I'm the health insurance agent for Attain, and I'm here to help you guys with open enrollment. We use a portal called mybenefitlink.com to help you guys make your elections online. All that information goes direct to me. It doesn't go to the insurance companies. So it just goes to me. And then our team works with the carriers behind the scenes. So this is a memo for the entire 2024 to 2025. Starting in January, we're going to have a 90-day waiting period for new hires. Last year, we had a first of the month following 30 days. So some of you are eligible now, but those hired after January 1, there's a 90-day waiting period for the policy. If you waive, you can't come back on the plan unless you have a qualifying event. And these are examples of a qualifying event. So basically, when you first hired and you get your offer, we're going to give you a link, just like you folks now are going through renewal. And we're going to talk about the open enrollment for those covered today. And if you're a new hire, these are your options. Okay. Right now we have Aetna as our health insurance, and we are offering the same three plans from 2023 going into 2024. So I'm going to give you a quick overview of that. When you log into the portal will actually show you your costs. This is a little description that I'm going to go over. You can read it later, but this is basically a description of the three. This plan is sort of, I'll start in the middle. All three plans are PPO plans that have in and out of network benefits. All three plans have 100% coverage for well visits. That's the Obamacare law from 2012. The difference here, the main plan says that when you go to your primary care doctor, you have a copay. When you go to a specialist, you have a copay. And when you pay a copay, the carrier, in this case, Aetna, pays 100%. When you go to an urgent care center, you have a copay. And when you go to medications like pharmacies, you have a copay. The deductible under these plans are more isolated to things like hospitals, surgeries. If somebody could mute their phone, that would be great. Apologize for that. If you're in the hospital, if you have surgery, or if you have an MRI, that's when you'll hit the deductible under this plan. And if you hit that deductible, you're done for the calendar year. You are required to pay 50% of the balance for those hospitals, surgeries, and MRIs. However, your maximum out of pocket, called a MOOP, is $6,500. That means your deductibles, your 50%, by the way, your doctor and pharmacy copays, they all go to the MOOP. So this plan is basically guaranteeing that no matter what happens to you, you have a $6,500 worst case scenario for the entire 2024 year. The plan on the far right is a little bit richer because it says that same hospital and surgery deductible, while it's higher, you'll see this little zero coinsurance. And what this plan is saying is that for hospitals, surgeries, and MRIs, after you meet your deductible, you owe nothing. So you're far less likely to hit your maximum out of pocket. Thereby, it is the richest plan in terms of premium and coverage. The first plan will make probably a little more sense now because there's a lot of folks that are looking for lower costs because they don't go to the doctor, they don't go to the specialist, they don't go to the pharmacy that much. And that's sort of the first plan. It's sort of catastrophic, but it's really not. And what I mean by that is there are a host of different benefits. I told you already before that well visits are covered at 100%. But notice here, if you get sick during the year, even your primary care, $0 deductible waived. There's no deductible for your primary care visits all year. There's no deductible for urgent care centers. And there's no cost for generic drugs. So those benefits, along with the well visits, are covered and free. If you're needing other claims, like a specialist, hospital, surgery, name brand drugs, you owe the Aetna discounted rate up to $81.50, and then you owe nothing afterwards because that's also your out of pocket. So they're basically telling you get a lot of stuff for free, but your worst case scenario is $81.50 for the bigger bills. We added this plan about 2 years ago, and there's definitely a lot of people enrolled on it because they're recognizing, hey, I can save money out of my paycheck. And that makes a lot of sense for people. So this is your time to choose. One thing I could tell you about insurance companies is when you pick your plan is that for the year. You can certainly disenroll and go elsewhere, but you can't change plans until January 1. Okay? Any questions on that so far?
Yes.
Hi.
So for the middle plan where it says like the pharmacy and prescription, so were we paying $50 every time for preferred brands?
Yeah, so you'll pay anywhere from $3 to $10 for generic, and then the name brand is going to be 2 sets of copays. The preferred drugs name brand is a $50 maximum, and the non-preferred is a $100 maximum. Those are your worst case scenarios, your maximum cost for a 30-day supply. It could be less than that, but that's the most you would pay.
And does Aetna have a list of like preferred and non-preferred medications?
Absolutely. So I'll jump to it here, but everyone should be going to Aetna.com to register once you get your ID number. Little blurb in here about you can print your own ID card, you can see your EOBs, you can see the benefits a little bit blown up, but also you can look for doctors, and more importantly, it'll find you your drug list. So it'll actually tell you on the medications if yours is a preferred or non-preferred drug. So there's no secrets, it's all online.
Okay, thank you.
And then where does blood work fall into this?
If it's done in conjunction with the doctor's office, it's part of the copay. If not, it's probably sent out to one of their participating labs, and it's in the form of a deductible, but you're going to pay the Aetna amount. Usually you'll pay the Aetna negotiated amount as it races towards that $1,500. And once you meet your deductible, you could owe half of whatever the negotiated amount. So it's covered. It just depends if it's done at the doctor's office or if it's sent out to a separate place.
Okay, and last question. Where does mental health services fall in these plans?
Let's see. I'm gonna see if I can pull up when you log into my portal. Give me 1 second. Let's see if I can pull up the benefit summary. I'm going to see if if for a lot of carriers, it's considered a specialist visit. So it's treated like a specialist. When you log into my portal, you'll see under each plan, this is the full summary of benefits. You'll see it. And I believe mental, nervous, let's see. So outpatient services, no charge. So take a peek at the summary of benefits. So no charge from Aetna to go to an outpatient office visit for mental health, behavioral health, or substance abuse. Did I lose you?
No, I'm here. Sorry, I was trying to think. So do you have to hit the deductible first and then it's no charge?
No charge means the deductible's waived.
Okay.
I definitely encourage everybody to click on the summary of benefits. The SBCs are 10 pages. And when you go on our portal, I'll give you a little screenshot here. Towards the end, we're going to cover the enrollment part. There's a little picture of how you go in and make your elections. Next to each plan, this little info button will launch the summary of benefits. So this is my benefit link. You're going to get a link for. You're going to how to enroll, and it'll tell you how many days is left in open enrollment. It'll ask you to pick any of the plans. You'll have to select to get started, and you'll see you can enroll or waive. And when you click on each one, it'll show you your costs out of your paycheck, and you can enroll or waive. The info button is a blow up of each benefit. Okay.
I'm sorry, I have a quick question. When is open enrollment? Or when does it end, I should say?
We're starting it today, and we'd like to end it on, I think we said we'd like to cut it off on the 11th. So we have all next week.
Okay, so as a new hire, if I'm not eligible for benefits till January 1st, they still make those elections now and they just won't start until then?
You can make the elections now, and you can also make it all the way up until pretty much, I think our process at Attain is to try to do it a couple of weeks prior to your eligibility. So
Okay.
new employees are sort of, the 11th is the cutoff for people that are already on the plan. For you,
Yeah.
you can certainly do it past the 11th if you want, but you could do it
Okay.
now. Aetna will automatically see your data higher and cover you according to the right date. So you could do it now.
Okay, thank you.
You're welcome. By the way, in terms of the page here with Aetna, all of the POS plans, this is a little instruction area about how to go to the Aetna website. You don't have to register to see their network. You can continue as a guest, or you can go in as a member. And when you get to the directory, you'll select a plan, and I outlined which one you choose. The open access, the first one right here, that's the network, and that's national, by the way. That's in all 50 states. In terms of the non-medical coverage, Horizon, this is how you can register on Horizon Blue Cross's website. We have our dental plan. Nothing's changing. I think the rate went up like $1 for a single rate. This is your cost per paycheck. The dental plan is a PPO. You have both in and out of network coverage. Diagnostic preventative major is paid at a percentage. And I given you a little summary here about what is preventative checkups, cleanings, exams, what's basic and what's major. This means the insurance company is paying that percentage. So if it's paying 80% for a filling, you owe 20%. And everyone that's enrolled is getting $1,500 of benefit every calendar year. So if they pay out $150 for a cleaning in the spring and $150 for a cleaning in the fall, that's $300 paid at 100%. You have $1,200 left to use for other things. So they give you $1,500 worth of coverage. That's how dental will work. And that's for everybody covered. Vision, we have with Aetna. If you have a medical condition, vision is covered under medical. But if you're looking for routine, like to get your eyes checked every year, or to get reimbursement for lenses, frames, and contacts, you need to buy a vision plan. You could see it $2 a paycheck for a single. It's very inexpensive. It's based on frequency, meaning every 12 months, which is basically every year you can get an eye exam. You can pay a copay for that, and then Aetna pays the balance at 100%. If you're getting a pair of glasses, it's sort of broken up with a combination of you pay a copay for the lens, you get a cash reimbursement of $130 plus 20% off. So it's sort of aligned to give you probably the actuarial equivalent is probably something in the $300 to $400 range per year worth of reimbursements and coverage at about $6 a month or $2 a paycheck. So there's quite a few of the Attain employees on vision. How to enroll, you're going to get a link today. If you're a new employee during the year, Jonathan lets me know about you. I send you a link and a welcome. It's the same process for everybody. You'll go in and you'll modify your elections. There's a little step in here. You'll notice steps 1 is registration. You pick your password, and 2 is your employee. You're validating your name and address, and if you have dependents. And then you'll move on to this one simple screen and you'll make your election. Select to begin, and you can enroll or waive. So you can enroll under medical and waive under vision, etc. After you keep hitting next, you'll sign, and then basically that goes to Jonathan and I, and then my team will enroll you. This is a little example about the Attain is giving you $1,800 a year towards your benefits. And I've broken the 3 plans out in sort of a quick sheet. These are the same three plans broken out a different way. And you can see the actual cost here. These are the same costs you'll see online.
Dan, I'm sorry. I just gotta head to another location, so I'm going to leave you as the host, and you'll see on the waiting room anybody else to let in. I'm probably gonna join again from the car, but I just wanted to give you the heads up.
We're probably done in about 5 minutes anyway, Jonathan.
Okay, no problem.
All right.
Thank you, guys.
Thank you. So for everybody else, then the last page is the Aetna's customer service, Blue Cross's, that's for the medical and the vision. And then you'll see Blue Cross's customer service. This is my team. That's me at the back. Okay. And Leslie helps me out with some paperwork. So if you need anything from us, let us know. And that's the memo. And again, at the end of this call, I'll send everybody a link, and Jonathan and I'll just keep watching it through our portal and just make sure everyone's gone in. Everyone needs to, for this open enrollment, all the full-time employees need to make an election, waiver or enroll. The waiver is online. You'll simply sign and be done. And obviously, we're going to look and see if anybody's made a plan change or if you're renewed. It will show you your current plan if you're enrolled today and ask you if you want to maintain that coverage. And that's all I had. I'll open it up for questions.
I just have a quick question. Are we gonna receive like this packet that you were showing? I don't remember.
So- Yeah, so in the portal, right in here, once you're done, there's a little dashboard, and this whole kit that I put, this PDF,
Mhm.
16 pages, will be in there in the document section.
Oh, perfect. Thank you.
You're welcome.
Do you have any questions?
Do we have,
I think he said he's gonna resend it.
you're gonna resend the link to this portal, right?
I'm gonna send that as soon as I get off the call.
Cool. Okay, thank you so much. Do you have any more questions? We are all set. Thank you. I appreciate it.
You got it, guys. Enjoy the rest of your lunch. And that's it. I'll end this recording, and I'll certainly send it in a YouTube video as well. I'll ask Jonathan to forward that out.
Great. Thank you so much.
Thank you.
All right. Bye, everybody. Have a good day.
You
You
too.
too.
Bye.
Bye.